Hi, I'm Liv. 7 years ago, I had a chance to get into the world of women and to explore a little bit about women, which I found really fascinating and interesting. Now, if you love interesting, real, authentic, and inspiring tale, then remember to subscribe to the channel. And as your comrade, I and my team will continue to give you premium type content. Ladies and gentlemen, we need to talk. Doctor,
Hey,
how is it? How are you doing? How are you
I'm
doing?
I'm good. I'm good, Lee.
I want to go right into it. I won't give you a chance to say all the introductions and all that stuff. But anyway, we can start with Alpha. Please, for somebody to get a little bit of some context, what do you do?
Okay, so my name is Dr. Karen Renee Zu, and I'm a board certified obstetrician and gynecologist, and that means that I take care of women right from the beginning until the end. I deal with problems with your cycle. I deal with infections, vaginal infections. I deal with UTIs. I deal with pregnancy, postpartum, menopause, cancers, like everything that has to do with women is my field. So that's what I do.
That's a smooth one. As we're getting started, we're just getting into all the nitty gritties. I love it when I hear professionals, they speak about, the passion of every single thing. Earlier, before we started recording, you mentioned urology and gynecology.
Yes.
Why did you choose to stay with one?
Um, urology has to do with men and women. Sometimes the men can be a little tricky. And for me, personally, I realized that I connected more with the women. So why not, right?
I
I
like
if I make more impact with women, then of course I would stick to women and help my own kind. That
Yeah,
is why I went into gynecology, and so far I think it's been really amazing.
lovely. So when I decided that I was gonna speak with you, I went to dig deep and reading. I've kind of found the podcast to be like my way of also getting myself informed
Okay.
and put all information together possibly. So you have a Facebook page,
Yes.
then people can find it. What's
Yeah.
the name?
So I have my Facebook page is Dr. Karen Renee Zu, obstetrician and gynecologist. And you can also follow me or join my Facebook page, Facebook group, which is Women's Health, Obstetrics, and Gynecology.
Right.
I use the same name, Dr. Karen Renee Zu, on Instagram and anywhere else on YouTube as well. So
Yep.
if you want to follow me, you can.
Definitely. I'll include those so that people can go and double check them. So I joined the group. I think I asked for permissions
Yes.
and I was reading through and there was a whole lot of
Yeah.
information and I didn't know where to start. So I was like, okay, I'm gonna do some trick here, picky now, picky dolly. I don't know if you do this. It's like you count and then you
Yeah.
pick whichever topic starts and then you include it. As I'm reading, I find that there is some healthy issues that may be specific to women. Listed was heart disease, breast cancer, ovarian, gynecologic health issues, pregnancy issues. I got interested. Why heart issues? Why heart diseases?
It depends on which context you are looking at it
Okay.
from. So if you are pregnant, for example, I know that the pregnancy itself can put so much pressure on your entire system, and your heart can fail at some point. There are some women that have like a heart failure getting to the end of pregnancy just because of the pregnancy itself. Okay, and knowing that, like I have to pay more attention to you if you go you reach the stage of menopause, because you don't have the estrogen anymore. The estrogen goes to you and you have a higher risk of high cholesterol, and high cholesterol can block your blood vessels and lead you to like have problems with your heart. So like all that comes together for me to say like heart disease is also like important when it comes to women's health. But um in the specialty, if you notice that a woman has a heart problem, you quickly send it to someone else who is more specialized in the field,
Right.
because we are trained specifically to deal with what has to do with like a gynecology, or obstetrics, anything that is outside the field is sent to the gurus so
Mhm.
that we are able to like save the woman better that way.
Yeah, cool stuff. Cool stuff. In this whole context of finding information, so I don't want to be discriminatory and only keep to women. That's like just a little bit. I hopefully I'm gonna tap into guys. I think guys should take interest in knowing about women's health.
They do. They
To
should.
some extent, I believe this is gonna help a great deal. I didn't ask for my partner to say this. I hope she won't kill me. The time that she first had an infection was when she was with me. So when we started dating
Yeah.
and when we started engaging in sex, that's when she first had an infection. So I had some understanding about what these infections are and quickly how to try and get help. And when they misdiagnosed how with something, I said, no, that can't be possible. It doesn't make sense. She's like,
Mm.
yeah, but that's what the doctor said. I was like, no, but I did sexual and reproductive health. So I know that this is not true. So when we had to dig deeper and it was just an infection, and then eventually she got rid of it, she took some teas that would allow her to, get rid of the bacteria. She took some antibiotics and whatnot later on, and everything went well. I recently visited home a couple months ago. It's no longer recent now, but that was like August. And I knew that this conversation would be coming. I spoke to about 15 to 20 ladies, and none of them has ever been to the gynecologist. Why?
Back home, most of the gynecologists are men. Okay. And we have this notion that men that always see the stuff, the good stuff, tend to be very promiscuous. And
Okay.
our culture is for you to keep your stuff to yourself. Okay. If the person is not your partner, or if the person hasn't gotten permission to look at you that way, then you might as well not show it. So they wouldn't go at all until it's really, really necessary to be in that uncomfortable situation and show what they do not want to show.
Mhm.
So the women don't want to go at all. And there isn't, like in the Czech Republic, you can just go to the GP obstetrician and tell them your problem. But back home, it's not like that. You have to go to the hospital, join the queue, and the hospital is dealing with more important things. Your UTI or your vaginal infection is not on the top of the list. And man, the nurses can be very cruel at home.
Right.
If you come there and you come and tell me that you have just a UTI, or why are you coming? We're busy. Find your own way to deal with it. So they wouldn't come at all. They are actually scared to go to the hospital.
But there
Mm.
is, I don't know how it is in Ghana, but in Zambia,
Yeah.
I think traditionally it used to happen. Now, not so much. So when the lady has her first period, so she has become of age, that means she goes through the rite of passage. So
Okay.
some teaching of some sort. And when women are about to get married, they also go through some teaching. What's fascinating, and now I'm kind of trying to ask, it's like, what are they talking about if they're not talking about these issues, about the health of the women, about how to take care of themselves, visiting the gynecologist? What is going on in those talks? How isn't this even coming through, even when their parents probably passed through the same thing? Why doesn't that get passed through so that people can learn?
I think that when they're of age, they only talk about hygiene, you getting pregnant, and maybe like your chances of being a good wife later on in life. But as to the care, gynecology, that is not a priority, because that's not something that we do.
Hmm.
You don't go to a gynecologist until you're pregnant, or not even until you're pregnant, until you're about to breast push out that baby.
Yeah.
So until then, gynecology is out of your way. If you go there, or if they realize that you're going there, then it's more like a stigma. Why are you going to the doctor? What
Mhm.
is wrong with you? What did you do wrong? Yeah. What did you do?
But
How
it
come?
shouldn't be the
It
case.
shouldn't be the case, but that's what lots of people have in their mind, that you only go to the doctor when it's very serious, when there's really, really nothing you can do about it. So
Oh
the
man.
parents don't pass it on to their children that it's something that you need to do.
Wow. So if they don't go very often, I read the part that says fibroids
Yeah.
are the most common ones. I have it here, and I think you mentioned it before we started recording. That quite common among us black women.
Yes.
Why? Why black women?
Nobody knows exactly why, but I should think that it's a genetic predisposition.
Oh,
Once you're black, it's in the genes, and you're more prone to having fibroids. It's just like when you're black or when you're African, I know that you're more prone to having preeclampsia or pregnancy, induced hypertension or hypertensive problems during your pregnancy, and I need to pay more attention to you. It comes with the genetics.
if it comes with the genetics, you did gynecology from here,
Yes.
so we are in a white dominant
Yes.
society.
Yes.
Do the doctors get taught about how to deal with black patients?
That's an interesting question. You know, you will learn about the fibroids and all that, but everything is in the context of white women.
Okay.
Okay. So if you get a black woman, you're treating her like you would a white woman, unless, of
Right.
course, you have gone to do some research yourself
Okay.
to know if the same applies to a black woman or not. Otherwise, no. You're not taught to deal with any woman outside your race.
So what are the challenges in practicing medicine
It's
now that you're in
challenging.
that space?
It's pretty challenging because the way, for example, a black woman would react to certain medication will be different from a white woman. I know that there are some meds I cannot give to a black woman, or I know that once I see a black woman that is obese, pregnant, the likelihood that she'll have preeclampsia is very high. So if I'm not able to do a complete screening,
Mhm.
I can put her on aspirin before she turns 16 weeks to be able to save her from that preeclampsia thing.
Mhm.
That's because I know that it's something that has to do with black women. But if I don't know about that, of course, I'll let her be. And then getting to the end of the pregnancy, it gets complicated. And I mean, I deal with the complication as it comes.
Yeah, but so I'm wondering where is the mismatch? If the learning is there for how to treat white women, and white women go to the gynecologist every month, and I had
Yes.
to learn this with my partner.
Yeah.
She every year she goes. I don't know if it's every 6 months, but she say, "Hey, I'm going to the gynecologist." I'm like, "Well, why are you going there?" And there's like, no, there's these regular checkups. Then they
Yes.
check up. They tell you, okay, you're okay, everything is okay, or maybe there's something that is not okay and it has to be addressed. Same as the dentist,
Yes.
same as the regular checkup at the hospital.
Yeah.
Back home, I only go to the hospital if I'm sick. And I think we need to make some changes towards that.
We do.
So,
We do.
at what age do the parents here tell the young girls to? When does that click that they actually take responsibility by themselves to go to the gynecologist? And in how can we copy that and also advise our female children to attend to the gynecologist every year, every 6 months? I don't know how often that is. What
Um,
is your recommendation?
Usually, you have to see a gynecologist every year for a pap smear. Okay. And that is just taking a sample from the cervix to make sure that you do not have a predisposition or you are not at risk of cervical cancer or you do not have cervical cancer. And if it so happens that there's something found on the cervix, there are some suspicious cells that I need to see you more often for,
Mhm.
or you have a fibroid, or I think you were a high risk patient, then I'll ask you to come back in 6 months or in 3 months, depending on what I find. But usually, every single year from the age of 21, you have to have a pap smear. Once you turn 13 or once your period starts, you can visit a pediatric gynecologist, a gynecologist that is specialized to deal with children, okay, to just talk about the female reproductive system
Right.
and just teach you how you have to like handle yourself if you want to be intimate and stuff like that. That's when you turn 13. When you turn 15, it's time to start visiting the gynecologist. Okay, so at 15, you come in, I do a scan for you, I check to see if everything looks okay down there. We can have a conversation about problems that you might have. And we can talk about contraceptives if you think that you would want to begin your sexual life, or you having problems with your cycle, for example, acne or heavy periods and stuff. We can talk about contraceptives and how to deal with it. If our parents teach us about this gynecology thing right from the start, right from when the period starts, that's okay. Now you are a woman. At some point in time, you have to start going to the gynecologist every year, or say, okay, I'm going to the gynecologist now. Just go with me. Go see how the place looks like, because very soon you will be coming there. I think it will be like more helpful. The children will get used to the fact that one day they would start visiting a gynecologist, and when the time comes, they will be more comfortable going there. Back at home, it's not like that.
Yeah, so it definitely it isn't like that, because among us the boys will say a vagina stinks. It stinks like fish.
But that's
We
not okay.
you see, so my question would be, because this is a conversation that is around the
Yeah.
boys. This is a boy side.
Uh-huh.
Ladies won't know about that. We just say, man, it stinks like a fish. Was like it's fishy or something is
But
fishy.
once it's fishy,
And then
then
we
you know that there's a problem down
exactly.
there.
But we throw all those things, around and stuff like that. So maybe my question is, why do vaginas stink?
Vaginas do not stink. They don't have to. They have their own
Okay.
special sweet smell. Not sweet, but like it's an okay odor. It can be a little oniony.
Smells like
smells
flowers.
No, that's a very suspicious vagina. But they usually smell like an onion. Okay.
Okay.
If the smell begins to change, then you know that you might be in a little bit of trouble. So
Okay.
if it smells like a fish,
Mm-hmm.
then I know that you very likely have what we call bacterial vaginosis that can come, for example, after intercourse, when the man ejaculates in the vagina and
Okay.
the pH changes. Then
Right.
there's an overgrowth of the bacteria there, and then you begin to sting like a fish.
Like a
That's
fish.
a problem. Yes, and that's not okay. If it's metallic, or if it smells like something died in there,
Mm-hmm.
then I know that you very likely had one of those STDs. Or if your discharge looks a little green, or like too yellow, or too like cheesy, I know
Yeah.
it's a problem. The normal vagina has an onion smell, and it has some discharge.
Some discharge.
Some discharge is normal. If you're dry, then you're reaching menopause, or there's something wrong with your hormones.
Yeah.
But a moist vagina is a good one.
It has
Yeah,
to be.
it has to be moist.
It has to be
Yeah.
moist. All right. You mentioned cervical cancer. Now we're talking about the fishy smells.
Yeah.
Let's talk about the hygiene part of it. Should they wash?
You should know where to wash. Okay. So lots of women back home believe that for you to keep the vagina clean, you need to put your hand in
Mm-hmm.
and wash with soap so that everything flows out, then it's clean. But I always say that the vagina works like the intestines. Okay.
Okay.
It sort of has the contracting movements that the intestines have, such that if there is something bad there, it brings it out.
Mm-hmm.
Okay. So if you have an infection and there's a discharge, the contraction just causes the discharge to flow out for you to know. Okay. So there isn't any need for you to put your hand there and wash. Washing inside the vagina just changes the whole pH and can give you problems. Some people think that when they wash, then it smells better.
Right.
That's them, but it's not the right thing to do.
But there is these products now that you wash and
Yes.
they smell fresh, and is that good?
It's for the outside. Okay.
Okay.
So the feminine.
And what is outside in this case?
The outside is wherever you see like the hairs outside that doesn't go into the canal. Okay, so
they can split the lips, wash.
yes,
with
just
that.
the outside.
Okay.
Just the outside. And
Okay.
you should go for feminine washes that have like an okay pH around 4.5 if possible, and
What is acceptable pH?
around 4.5 should be
4.5.
okay.
Okay.
And they are not too perfumed, because
Okay.
those perfumes can be a little irritable and cause you problems down there.
Back home, there is the influx of male circumcision. I mentioned about it earlier. I did male circumcision solely for the purpose of hygiene.
Okay.
But I want you to clear this out for me, because they believe that when a guy is circumcised, they reduce the chances of getting an STI and the STDs. They mentioned to an extent there's no much tearings, which is debatable, obviously, because you're having that friction during sex.
Yes.
But this is what is believed. So most of the guys are going for circumcision because the thought is it reduces the chance for them getting an STI. I did for the solely purpose of hygiene. But obviously that information was there. What is the truth about it?
I believe that you can still get an STI whether you're circumcised or not. Okay, it's something that you can get. For example, if you have like a gonorrhea, if your partner has gonorrhea or anything else, I mean, the mixture of the fluids can still give you an STI.
Right.
It just goes through the urethra, and it can just go through. You don't need to get rid of your foreskin not to be able to get gonorrhea. If it comes with like a HIV, for example, then you not having your foreskin reduces the chances of you getting the tears and then blood mixing with blood, right? And reduces your chance of getting that HIV. But I mean, just having unprotected sex is a risk of like on its own. The circumcision is beneficial for hygiene, like you said.
Yeah.
Plus, it reduces your chances of having like these penile cancers later on in life. Okay.
Right.
Plus, when you have the foreskin, because you're not able to take very good care of it, it becomes like a little more fixed, and you can have what we call phimosis or paraphimosis. Okay.
What is it?
Phimosis is when the foreskin is completely like stuck and it becomes closed, such that you're not able to pull it back and clean anymore. So you just see the tip of the penis with the opening, and the skin doesn't move. It's completely stuck. When we say paraphimosis, that is when somehow, for example, during intercourse, the skin that is stuck goes below the tip of the penis, the glands of the penis,
Right.
and then it gets stuck there and becomes like inflamed, like it's swollen.
Yeah, because so when I was young, the penis didn't open completely. So the dickhead was, I don't know if this is appropriate language on TV, but it wasn't opening completely to leave the head
I
out.
think you were not pulling it out.
No, like I mean, at the beginning it wasn't.
Okay.
Then as I grew a little older, and I'm getting to meet girls and stuff like that, so I have an erection time and again.
Okay.
Then it started tearing, and then the head came out, and then shortly after that, that's when I got circumcised.
Okay.
So when you're saying it gets stuck, I'm wondering if
It does get stuck in children too.
so maybe it was just stuck.
Yeah, very likely.
Damn. So I escaped that. Yeah, because then later on it opened, and then I know that in most kids it doesn't open yet, like until they start growing a little older, and then it starts to open.
I think you start paying attention to it when you start to notice yourself. The kids don't really have any use for it, so they don't really try like to.
That would be
Yes,
the case.
yes,
That would
yes.
be the case. They say from the circumcision part that guys who are not circumcised contribute to the cervical cancer. How is that true?
When it comes to cervical cancer, it just has to do with your partner passing on HPV to you. Okay. So if your partner doesn't have the papilloma virus, usually type 16 and type 18 that are higher risk for cervical cancer, then I think it should be okay.
Because the story, I'm telling you these things because I was in that conversation, right?
They told you different stories.
Yeah,
oh my goodness.
So before the circumcision, they would say the white substance that is in the foreskin,
Yeah.
that it carries the HPV. somehow. I don't know the chemistry around that, which you need to tell me.
But
That it
HPV
carries.
is an infection. You should get it from somewhere.
Okay.
If you don't like
So somebody who probably has multiple sexual partners gets the HPV from somewhere.
Yes.
So then it accumulates in the foreskin
Yes.
of
And then they
into the
pass
white
it
sub.
on.
Then they pass it to the
Yes.
partner. That is only acceptable way, I'm assuming.
What do you mean by acceptable?
Acceptable way of passing the HPV that causes cervical cancer. So circumcised men don't pass the HPV?
They do.
How?
If the HPV is like it's part of you, okay. For example, if I have to do like a
So I have HPV.
okay, if you have HPV, it will be in your fluids.
Okay.
Okay. So if I have to do an HPV test for you, I just do a swab from the urethra for example, and it tells me if you carry the HPV or not and what type of HPV that you have.
Can I get tested?
You can.
Nice.
You can get tested. The urologist will be able to help you with that.
Okay, it doesn't hurt.
It's a little.
I don't like
it's
doctor. I don't like everything that hurts.
It's a little ticklish, but it's not painful. It's not painful.
You sure?
Yeah. It's uncomfortable,
Woo!
but it's not painful.
Okay, so I can get tested for HPV,
Yeah.
and then that way you're able to know. And is it curable?
You very likely will carry it like for the rest of your life.
Okay.
But sometimes it happens that, for example, somebody has HPV and we take that part of the cervix that the HPV was found in away, and we do another test and it's gone.
And you said type 16?
It's like type 16 and type 18.
16 and 18.
Yes.
And are these the HPV, is it naturally occurring in men?
Anyone can have HPV. Anyone at all can have HPV. That's why it's important, if you can, to get vaccinated against the cervical cancer and HPV.
But if anyone can carry, so men need to get vaccinated for HPV as well?
Yes. Little boys are vaccinated as well.
That's not a conversation at home.
Yeah. It's now pretty common that they are vaccinating lots of women and boys now.
Oh, yeah. Now both of them are getting vaccinated.
Yes.
Gentlemen, let's get vaccinated for HPV so that we don't pass it to our partners and, reduce the chances of getting them cervical cancer. In terms of hygiene, particularly, when we only tell girls, we don't say anything about guys.
No, because the smellier you are, the better, right? I mean,
we're having that. There is nothing sexier or manlier about smelling.
No, but
you need to take a shower.
No. This good smell is it's a new thing, a new trend.
Oh, it's a trend.
Yes,
okay.
It's a new trend.
Okay.
Like that's like when a guy is smelling good and sexy, then that's a real guy. But back in the day, you have to smell the testosterone from far away to know that that's a real guy coming.
No, but that's please. Let's just shower.
No, but it's good to take a shower.
Thank you so much. We'll definitely keep with the shower. So the nice fresh fragrances. This is a new thing now.
Yeah.
My partner was telling me about this. Like also, she said some queen of some sort, one of the European queens, I think. And she was telling me a story, at least, about something. And it's like this one. She was a princess. She only bathed the day that she was getting married. And something. So the smellier you are, the yellower the teeth. That was like attractive.
Yeah.
That was the thing.
That was the thing back in the day.
Why?
Yeah.
Why?
I think it was because of the poverty. Plus there were no the resources were not there. Like the soap was hard to come by. Plus, I mean, why should you take a shower, right? When the smell is normal for everything smells anyway. Nobody can tell if you're smelling good or not.
Right.
So, no waste of time.
there is a there is a stigma around contraceptives. Should people take contraceptives?
That's a good question. You know, contraceptives can be used for so many things, or hormones can be used for so many things. Okay, so I can give you a contraceptive because you don't want to get pregnant, so I give you like options to choose from. I can give you a contraceptive because your periods are heavy and I need to reduce how much you bleed or stop your bleeding completely so you don't have anemia. I can give you a contraceptive, for example, because you have ovarian cysts and I need to make sure that the cysts don't develop again.
Mhm.
I can give you a contraceptive, for example, because pregnancy, you cannot get pregnant or you are not allowed to get pregnant because it's very risky for you. Like it might end your life. So
Mhm.
I put you in contraceptives to make sure that you don't get pregnant and you sort of stay alive.
What are the good contraceptives then that prevent people from? You mentioned a lot of them,
Yes.
but it's like the one that prevent ladies from getting pregnant. What are the good ones? Because I hear most of them have got side effects. Some ladies go crazy, some gain weight,
Yes.
and whatnot. What? And I'm assuming every person is different.
Yes.
So, what is acceptable in your practice, in your experience? What would you advise?
So one contraceptive does not fit all. Okay.
Okay.
I need, before I put you on contraceptives, I need to know if you are at risk of blood clot formation. Because if you are at risk of blood clot formation and I give you a contraceptive or birth control that contains estrogen, I might
Mhm.
cause you to have a stroke and kill you.
Okay.
So I cannot do that. I have to make sure that you don't have like any problems with hypertension because some of the contraceptives can cause you to have a crisis with your blood pressure and can kill you.
Mhm.
I have to make sure that you don't have like epilepsy, you don't have like breast cancer,
Mhm.
you don't have cervical cancer because all these things can worsen your situation.
Mhm.
Okay, so you have to check all that. Check to see if you don't have cervical cancer, if your breast is okay, if you're not having any like suspicious bleeding that you don't know about, if you're not at risk of what's it called um, if you're not at risk of getting the blood clots to make you stroke out,
Yeah.
or if you like the contraceptive I put you on is not going to give you seizures
Mhm.
or like cause you to have crisis in the case of um, sickle cell.
Yeah.
For example, in our case, there are lots of sickle cell women, and if I put that person on contraceptives like a combined oral contraceptives that contain estrogen and progesterone, I can cause that person to have more crisis and kill them. Okay.
Yeah.
So it's not one fit all. I need to know your complete history and based on that, know exactly why you need the contraceptive, if it's for pregnancy, if it's because like you just want to enjoy yourself,
Mhm.
or if it's because you don't want to have children anymore,
Mhm.
your family history, and based on that, I guide you gradually to pick the right one that suits you. Okay.
Yeah. Well, people are struggling to get pregnant.
Yes.
One thing I heard was if when they're off contraceptives, some take a little bit longer to regain the normal
Yes.
cycle and
Yes.
everything comes in. So you mentioned one does not fit all.
Yes,
You've heard
that's
of
important too when
yeah.
you're choosing the contraceptive type because you need to know if you want to get pregnant again or you don't want to get pregnant
I
anymore.
see.
Yes, and how quickly you want to get pregnant after you stop
So
contraceptives.
don't just go and buy a contraceptive.
No, no,
See
no.
your gynae so that
Yes,
they recommend.
exactly,
Makes
exactly.
sense.
Because if you're going to plan a pregnancy in about a year or two,
Yeah.
I wouldn't, for example, put you on Depo-Provera, that's the 3 month shots,
Mhm.
because after you stop using it, it can take 18 months for your cycle, like your ovaries to get active again. And
Yep.
that is going to delay you. Okay. If I know that you're going to plan in 6 months, I can put an IUD.
Mhm.
That's the stick thing that you put in the uterus. It can be hormonal or non-hormonal. And once I take it out, the chances of you getting pregnant are pretty like quick and easy.
Right.
Yeah.
Um, you've you know this one. There's a pull-out method.
Hey, no, 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 no.
Doctor, you
No,
have
that's cheap. That's very cheap
What
and
do you
free,
mean
but
that's cheap?
no.
I have survived on pull out the
No,
whole time.
No, because you just got lucky. You just got lucky. There's just going to be a point in time where you forget that you have to pull out and it's late.
No, I have never forgotten. So at least I've survived. So
Most people don't.
most people
don't.
no, my pull out game is on A, like I'm on my A game
No,
right
but I
now.
think that it's very stressful. I mean, you have to concentrate on what you're
Yes,
doing, right?
and that's what I do.
No,
I
but-
make sure I am concentrated.
But your mind is somewhere like, okay, ready, steady. This is the time I need to. No.
Yeah,
No.
one of my friends
It just destroys the whole ambience. No.
One of my friends was laughing about this because I was telling him, it's like I have calculated, like I have a mathematical equation to this.
No.
Like there's a part where you feel the tingle that it's coming now.
Almost, yeah.
And I have at most 3 to 4 pumps in there. And if I get past 3, I need to get out of there.
No, but you know what? Lots of men forget that maybe that is the point where the woman is also reaching orgasm, right? And you pull out and you just end her.
I'm gone.
No, that's unfair.
I'm gonna continue.
No, but that's unfair. Like you just leave her in the middle. You give her sort of blue balls, and you want to start again. No.
Look, I'm gonna make sure I get back to you, darling.
No, we don't want it that way.
But at this point,
No.
let me, and then because I know after the 3 pumps, I have to get out of there. Otherwise, I'm finishing everything in there.
Lots of people. So what if like your partner just grabs you?
No, it's not supposed to happen. I need
But you
to
never
make.
know.
Well, I think I've been lucky then. All right. So then I went to get tested. I went to the fertility center. You know, now we're getting older, and I'm like, okay, we're gonna think of a family. It's like, maybe I've been pulling out blanks. Guys, we laugh about this and stuff like that. But then I went to the fertility center, and I was like, man, this is some really serious thing that is going on. Luckily, or fortunate for us, everything is okay. The volume was all right. I think they said the consistency was thicker than normal, but they said that is okay.
Yeah.
Drink more liquids and activities, and then it should be okay. My partner is also completely fine. But when I entered the facility center, wow.
It's a good business.
You could see people, the stress, the sadness. And I was like, man, people are really struggling with this, and they need to work around.
It's a big deal.
People are breaking up because of this.
No, because if I want a family, okay, and I notice that my partner has blanks, okay,
Yeah,
or my partner's sperm is just full of
just
unfunctional sperm.
Sorry to cut you short. This is not anybody's fault, correct?
No, it's not. But
Okay.
some men can cause it. Like you can be the reason why your sperm analysis is poor. If you're drinking,
Okay.
if you're smoking, if you're using steroids, the steroids are like pretty bad.
Okay.
It destroys your semen, and it can take quite a while, or sometimes can be irreversible.
Okay.
Your semen quality is like completely gone.
Okay.
If you're using drugs, it's 0 for you.
Mm-hmm.
So if I see a bodybuilder, I know that's what is in there. It's very likely a 0, so I better stay away. If I go with him, then I should expect him to have fertility issues, because very likely he's using steroids, and that will have an effect on his sperm.
But normal going to the gym is okay.
That's okay.
Ah, okay,
That's
cool.
okay.
Then I'm good. I was like, oh, you should stop working out.
Once the steroids are not part of the game, it's okay.
I see. And on the women's side, what is causing this now? People are struggling with this.
People are struggling. People are having like a primary ovarian failure, which means that your ovaries reach menopausal stage, sort of, before they're supposed to reach there. Okay, so you are maybe 30 or 35, but you don't have a lot of eggs left, or you have 0 eggs left, and you need to borrow from someone else to get pregnant, or you've had some STDs like syphilis, chlamydia, and they've completely damaged your fallopian tubes. Because of, for example, promiscuity, or because you got that infection from somebody else. Obesity, coming with lots of PCOS, that's polycystic ovarian syndrome.
Mm-hmm.
That's also causes you not to ovulate, causes your cycle to be irregular, and once you have that problem, it's going to be very difficult to get pregnant.
Mhm.
And once you're obese, the body has like insulin resistance,
Okay.
and that also makes pregnancy almost impossible.
Mhm.
And you know, from like back in our world, or like the men back home prefer, you know, the plumpier, like the chubbier you are, that's the real woman. Like,
Yeah,
yeah,
you
yeah,
know.
yeah. So a woman needs some flesh.
Exactly,
So,
exactly.
and with the flesh comes all these problems.
I see.
Yes.
I see. So guys need to work on that as well.
Yeah, they need to know that it's not the flesh can cause, like, it's nice, like, you know, to have something cushioning to lie on and stuff, but bones are okay too. Like the bones are okay.
Why would you say bones are?
No, not bones, but at least like
No.
you're feeling some bones, it's okay as well. Like being
Ah, mate.
your woman being fit is okay. It's okay. It's beautiful as well. Like but you can be like a skinny and still have PCOS.
Wait,
Polycystic ovarian syndrome.
you have a kid now.
Yeah.
Is that your first pregnancy?
Yeah.
Beautiful. Getting pregnant for the first time. What changes? And when I'm talking about this, I'm interested in you have a partner, you are intimate.
Yeah.
Then you get pregnant. What is going on with the intimacy?
It
Well, after you give birth,
it
what is
depends.
yeah.
It depends. Okay. So this is my second pregnancy.
Yeah.
Because I lost the first one. Okay. It's very, very common.
Sorry about that.
I'm okay.
Okay.
It's very, very common for women to miscarry during their first pregnancies. It's
Okay.
like 1 in 4 women, and lots of people don't know this, so it's really, really hard. Like, it hits them hard. But
Yeah.
first miscarriage doesn't mean that you're not okay. The second one usually works. If you have a second one, then you need to seek help. So I miscarried the first one, and I still remember, because I was working, I was on shift in the hospital, having cesarean sections and delivering people, and I was having a miscarriage, and I couldn't take a day off.
No way.
Yeah, it was terrible.
Wow.
So the first one went that way. The second one was successful, but along the line, I was sick from the beginning till the very day baby came out. So my baby came out at 28 weeks and 3 days. Okay, she was very premature.
What is the normal?
At least 37 weeks.
37 weeks.
Yes. So at
28.
yes. So she
So-
was like 950 grams.
Yeah.
When she came like a loaf of bread. So, or a box.
Why do you have to use that analogy?
No, but so you
No.
see the so you see the exact like weight of the baby. She was very, very tiny,
Yeah.
and we had to be in the hospital for like 3 months. Yeah, it was challenging. So the whole like pregnancy period for me was not rosy, because I couldn't eat. I lost like 8 kilos. I was always vomiting, but I was working.
Mhm.
And if you're vomiting and you are like too tired to think about other things, then you wouldn't concentrate on being intimate and like, you know, being lovey-dovey. And
Yeah.
but some women go crazy when they get pregnant. You know, the pregnancy causes the increase in blood flow to the pelvic organs. Okay. And that increases the libido, or that can increase.
Okay.
Yeah.
Okay.
So if you notice
I'm
that
looking forward to that. Okay.
If you notice that your woman has become like more like a more wanting or more
Yeah,
needy,
yeah.
it might be because of that. Yeah.
Okay. I love pregnancies now. I hope that is the case though.
Hopefully. Some
Hopefully.
are opposite. Say
Okay.
that they have zero libido from the very beginning to the end.
How do you deal with that?
You have to cope with it because she doesn't want you.
Damn.
If she has zero libido, then she has no mood to deal with whatever you're bringing.
I'm a very, very sexual person.
Then,
And we're gonna need to have a discussion
Yeah.
about that. Because
but once you see how
I'm only
you're-
not sexual when I'm busy. When I'm busy, I'm like completely off.
but
And I'm doing my thing and stuff. But the moment I'm like available and stuff. But I'm wondering if
you
she's
would
pregnant for 9 months.
yeah, maybe in the beginning of the pregnancy she'll be so sick that you would even be worried
Worried.
if she would survive the pregnancy. Like she would be very
Right.
fragile.
Okay.
But as the pregnancy progresses, like the second trimester is usually like the honeymoon stage.
Okay.
She feels better about herself, like she's going for pregnancy photo shoots and stuff. And
Is that right?
yeah, so maybe that period you can get some.
I can get some.
After that,
Yeah.
when it gets to the third trimester, when she's so huge and like finding a position is a little uncomfortable, then it becomes
Right.
challenging as well.
Well, how about working out during pregnancy? Do you advise that? I
It's
see women lifting, and I'm like, I don't know if this is healthy, but
it depends on what you're used to before pregnancy. So if you're used to working out before pregnancy,
yeah,
during pregnancy you can work out, but take things slow. Okay,
slower. Okay.
nothing that will cause maybe someone to kick you in the stomach, or nothing that will cause you to fall down or put too much pressure on you.
Okay.
If you do not exercise at all before pregnancy, then guy, it's not the time to start it. Yeah, don't start
Okay.
anything. Your blood volume is going to change. Your heart is going to have to start working for two, and
For
adding
two, yeah.
exercise just puts you into like under too much stress,
So
and
it's
can
either you start working out before the
yes,
pregnancy and
yes, or wait till the end. You can take walks when you're pregnant. That's if you're not on bed rest, but
okay.
otherwise, no new things. Yeah.
Okay, no new things.
No,
Now,
no.
so but the gaining weight and getting rid of that,
It's hard.
oh man.
It's hard. You can gain some weight, like 12 kilos is okay, 20 kilos maximum, okay. When the baby comes out, you shed some, but after delivery, if you don't pay too much attention to yourself, because very likely you'll be extremely busy paying attention to the new human that you've created, that
Yep.
you forget that you
Yep.
actually exist, okay.
Mhm.
That's what like cause you to have lots of stress. Stress comes with like eating here and there, not paying attention to your meals. By the time you realize it's 1 kilo after the other,
Mhm.
and you have gotten to a point such that even walking or like carrying yourself to the gym, it's a big problem.
Mhm.
Like, you know, that's when you get to a certain weight, it's very, very difficult to actually start working out. It
Mhm.
takes the grace of God, like really, man. It takes the grace of God to start working out when you get to some point, because you are really exhausted.
I
You
see.
are exhausted.
Uh, so you getting pregnant at home in Zambia.
Yeah.
At least I've seen this, and I hope I've seen a little bit of a different approach here and stuff. So I see the dads going into the room to give birth.
Yeah.
I told my partner, and we fought about this, and now we have agreed that I'm not gonna be there. And I told you that I don't think I want to be in that room. I just don't think I can stand that.
But when you see what your partner is going through, you actually have more respect for the
I
entire
respect
journey.
women.
No, but you have to see that.
No, but
no.
why would you accept my respect without being in the
No,
room?
it changes things. It really changes things. Like once you see that and you go home with that baby, you're like, hey, this woman really suffered. I should probably take the baby so she can take a nap, or maybe I should cook her a meal, because guys, it's not easy. But
But
if you
what if I do it already? I'm a very
no,
I
that's
think my
you.
partner can testify on
That's
that.
you. But you know that's in like there are so many men who would not even lift a finger, because guy, I don't care. It's the woman's job. She has to cook.
That is true.
Yes,
That doesn't
yes.
happen in
Yeah.
Zambia, and I think it has to change. There is this thing of women are going to do this. The lady's pregnant.
Yeah.
She's juggling things
Yeah.
back and forth, and
Yeah.
I think that is wrong.
Yeah.
I think, gentlemen, it's okay to wash the dishes. It's
It
okay
is.
to cook for
It
the
is.
lady.
Yeah.
It's okay to clean the house. We are busy now. Your wife can be a doctor, your wife can be a teacher, and if she's not around, get home, clean the house, and
The more helpful you are, the more pleasant your wife is going to be, and the more
Right.
you're going to get some.
Yeah.
Because if she's frustrated, she's not going to be there for you. She's tired. She's tired.
Yeah, because we have this lady. She's beautiful. We get her pregnant, and then she has a kid. Now she's working back to back, and then when you come back from work, she's wearing these dirty clothes. She hasn't showered. Probably doesn't smell pretty good. She's sweaty. And then at the office, you have this secretary. She doesn't have a kid. She's probably
No, but
fresh.
you ask yourself, why? How did she get into that state?
That is the
You
thing.
made her that way.
You see what I mean? But then, is there something that we can do so that women can look fresher for their husband after giving birth? Because there's that switch.
Yeah.
There's the attention on the child, on home chores and stuff like that. Then kind of get to forget a little bit about the guy.
You
How do you create that
switch
balance?
switch it, and put the guy at home to take care of the children just for a few hours. He would look more crazy than the woman when you come back. Yeah.
Really?
Yeah, trust me. Trust me. As soon as you walk through that door, she'll say, "Lady, woman, come for your child. I'm done." It's not easy. It's not easy. It's very hard, really. I mean, women don't say it enough. It's very, very, very hard.
Why
It's
why don't they say it? Because I think most of the women go through a lot of things and they're
Yeah.
quiet on most part.
But we whine a lot. We're always complaining. No, it's hard. And so when it's really hard, nobody takes you seriously because, yeah, she's complaining again. You know,
Oh, it's
it's a thing that women do.
right.
Yeah.
But why do
Yeah.
they complain so much?
It's a woman's thing. I mean, women complain. We whine.
Why?
It's a
Do you
woman's
know
thing.
why?
It's just like men don't whine. Men will focus and solve the issue, but the woman wants to tell you, I have this problem and this problem and this problem. Can you solve it for me? Oh, there's another one. Like, just listen to me. I'm still talking. You know, it's a woman's thing.
Well, I was reading something about, now that we're talking about the birth.
Yeah.
I was reading something about, some guy was arguing to say, why do women give birth laying down and not against gravity? How does that work? That I should be, don't go against gravity so that they can give birth the other way.
You
instead of-
can. You can. You know, there's a new trend, or like a new trend of old things. Okay, that's
Okay.
they are the bio mothers.
Mhm.
Okay, or the mothers that don't want any intervention.
Oh yeah, you told me
Yeah,
about this bio
yeah,
mother thing.
yeah. They don't want any intervention during the labor process. Okay, that's fine. It's okay. Everyone has a choice.
Right.
If you want to give birth standing, you can. If you want to give birth squatting, you can. But what about that person that is there supposed to lay on the bed and try to catch your baby, lay on the floor and try to catch, it's coming with fluid. So you're waiting, where is the baby? And then splash. There's everything all over. You're not able to protect the perineum.
Yeah.
If baby falls through and you don't have any cuts, thank God. But if baby falls through or baby comes out, and because I'm not able to protect you, then you have very severe tears
Mhm.
that comes with bleeding and like problems later on in life, then is it worth it? Like, is it really worth it because you wanted to fight against gravity? I mean,
But which one is the easiest way now?
because we are used to the position on the bed, for us it's convenient, but for the mothers it can be a little uncomfortable because they are laying on their back and they have to try to push in a position that they are not comfortable with. I mean, if you're standing, you can just bear down and just release what you have, right?
That's the point.
Yes.
That's the point.
But laying down is a little uncomfortable, but it works medically. It works medically.
So is there a way on how that could be improved, or maybe just put the bed in a slanted position
no.
at least?
No. The slanted position is not okay. You need that, like, for the baby to pass. I need to be able to help you. You can deliver on all fours such that I'm able to see the baby coming and I can sort of protect you from any tears. If it so happens that baby is in distress and I have to turn you to your back and do things quickly, of course, I will do that.
You mentioned something about tearing. So
Yes.
sometimes you tear people if the baby is too big.
Yes.
Where are you tearing?
Why or where?
Where?
There's you make a cut in between, like when you look at the vulva, okay,
Yeah.
and you look at the anus,
Mhm.
and you compare it to a clock. So you can make a cut at number 6, number 7. Number 7 is even too far. Okay, so not 6. You can make 6 o'clock,
Mhm.
or you can make 7 o'clock, or you can make 5 o'clock.
Okay.
Okay. If you make a cut at 6 o'clock, it's the suturing is okay, but once it tears, it goes through the anus.
Okay.
Yes. If you make it 5 or 7 o'clock, you can tear through the anus as well, but it's a more like a protected area to give
Yes.
more room for the baby, like, and prevents the baby from going through the anus, because those ruptures or those tears are pretty nasty.
I got the same reaction when you mentioned about some women tear through the anus.
Yes.
When you go through an experience like that, do you want to give birth again?
No. No. You don't. The pregnancy, delivery, postpartum in itself is very hardcore psychologically. Okay,
Mhm.
so if you go through any trauma during pregnancy or during delivery, then it's very, very, very hard for you to want to do it again. There are lots of people who just go on and get pregnant because I've promised myself, for example, that I want 2 kids, so I'll do it and get it over and done with. Some are not able to go like past the trauma and they just stop at one.
I want to have 8 kids.
I don't. I think you'll change your mind soon. No, I think you'll change your mind.
Why does everybody keep telling me that?
No, you'll change your mind soon. When you have one and you notice how the sleepless nights are going and how exhausted you are, you think about the 8. Guy, I wanted 6. I'm okay with 1 now. Maybe 2. But no, no.
I really, really want 8 kids. I don't
No,
know, but there's
no,
just this is like 8 kids. Like these are my boys. I said
no.
me, my partner, and all of these nuggets are my kids.
But what happens to your partner?
Well,
Because
well,
8
that's
kids.
the part we've been talking about. Apparently, the body changes.
Yeah.
The body gets messed up. This is why I
Yes.
think Czechs have only 2 kids.
Your body can get messed up after 1. Your body can
man.
get messed up after 1.
But
one
I've
kid.
I've seen fresh older women who have
Yeah.
had kids and they're back in shape. We call them MILFs.
If you take good care of yourself
Yes.
before pregnancy, during pregnancy, you very likely will look good postpartum as well.
Okay.
Yes. So, but if you're not like you don't exercise or you don't take care of yourself, then the likelihood that you wouldn't exercise postpartum and you would gain some weight and the weight stays there is pretty like high as well.
Yeah, I'm very rude. Not maybe I'm not rude. I'm very direct. I just say things that come in my mind.
Don't try that postpartum.
Yeah, and that's what I wanted to ask.
She'll
It's like
kill you.
I don't think I should say
No,
that.
no.
I was like, one time she gained some. I was like, damn, babe, you fat. She
Hey.
got
No,
angry.
you don't say that.
But here's the thing. That's what was on my mind, and I just said it. I didn't mean
But you
to.
can say like you're looking beautiful in a chubby way, like you.
No, but the truth is that she's fat.
No, but that's not a nice thing we want to hear. Nobody wants like to be called fat, or nobody wants to be told that there are some extra folds that you're really fighting to get rid of, but it's not going away. Nobody wants that, because when you look at yourself in the mirror, of course, when you see the models and how they look good, you also want to look good. But why the extra kilos are staying, you don't know. You are putting in effort, but it's just not working.
Yeah, but I mean, I like a little, she's thick. She has everything. She has a little tummy. I like to play with it.
Yeah.
It's a little thing, you know what I mean? So I like it. Just not too fat. But boy, she gained some weight, I'll say she's fat. I mean, then that's gonna make her work hard.
But can you just like try to work out together instead of saying fat?
Okay.
Or maybe take more walks together, go on other adventures so that she's more active. Instead of saying fat, you can get her to the size that you want without saying like something that will hurt her.
Okay.
Because once she shuts down, that's it. Yeah. She will work out, but she might not be working out for you.
What does that mean? What does that mean now? Come on now.
No, but if you don't want me, somebody else might want me the way I am and wouldn't say these things to me. You know how women are. Like, you might say things, you might laugh about it, but it's
we laugh about this thing. Back home, I don't know how this is, but here there is this classic phrase. Ujmienebavi.
Mm-hmm.
Classic. It happens. Guys have dated for 5 years, 10 years, 15, 16 to an extent. And then one day she just says, Ujmienebavi.
It's not that one day. It's been like that for a while, actually.
But
she just tolerates you until it's time to say goodbye, and then she just.
So are we safe?
No, but guys also do that. I mean, a guy can be with you and have another partner, and then one day you just see a wedding invitation and he's gone. He doesn't even tell you "Ushmi Todabavi."
So you're saying it's courtesy.
The only difference about women is that women can be very calculating. She's quiet and you might take her for a fool, but she knows exactly what she's doing. Like, don't underestimate her. She knows exactly what she's doing. When the right time comes, you'll get what you deserve. Yeah.
Man, I've been telling my boys, I'll be like, gentlemen, Anybody
Mm.
can get
Yeah,
this.
anyone can.
And at
Anyone.
that point, when that moment comes, you
Anyone
better
can.
be ready to
Mm.
address that
Mm.
conversation and go through the consequences.
The same way the women love like unconditionally. You can be poor, have nothing, but she will still love you for what you are. It's the same way she can ghost you when you make her mad or you make her stop loving you. Yeah.
Man.
She loves hard or she doesn't love at all. Hmm.
Now I'm getting scared. Doctor, why? Why would you get me like this? I'm
No.
thinking twice about it.
No, you shouldn't. You should know your partner. You should know who it is that you're doing life
Oh,
with.
she's really loving it.
Yeah,
Yeah, I've improved. I'm more of a better person. I'm less rude to people before I am actually rude. Well, I don't call it rude. I think I'm bluntly honest.
Okay.
But these days, when somebody says something, I'm gonna I'll double check. I'll be like, okay, maybe I shouldn't respond. But
Okay.
if you push me too much, I'll step on your toes for sure. So I'll make sure that there is that conversation around that. We've been mentioning something about postpartum,
Hmm.
and it's a serious thing.
It is.
On the news, at least this is May. This whole month, I think I've heard it like 3 times, and the recent one is a few days ago.
Hmm.
That some women don't like their children afterwards, and there's a whole lot of things going on. There's
Yeah.
anxiety, there's
Yes.
depression, there is mental issues get to develop at that particular point. What is postpartum? And I think in Zambia people are going through it,
Yeah.
but we just maybe don't know what it is, and we think we shouldn't talk about it.
Hmm.
We hear people have left their kids somewhere. We hear it on the news. So what is it?
You know, the postpartum period is like once your baby comes out, okay? Once pregnancy ends, you begin your postpartum period. Most of the time, the doctors or the clinics will tell you that you have 6 to 12 weeks. That's the postpartum period. But the whole thing goes through till about 2 years after your baby is born for you to become a normal person again. Like it can take you that long. And during that period, because of the change your body has gone through, because of the change your brain is going through, you're lactating, hormones are all over the place. You have a risk of the anxiety, you have a risk of depression, you have a risk of psychosis. I mean, like it's a very, very difficult stage because you can't just pay attention to yourself. You have another human being that you have to like pay attention to. And if you don't have any help, then you can imagine being stressed, sleeping, not sleep deprived, hungry, tired, and your hormones are all over the place, and you still have to take care of another human being. I mean, I don't know how men can do that, but I think women are superheroes when it comes to that. Like,
Man,
it's hard.
it
It's
sounds
hard.
like a really difficult thing. So how can we as guys help women get past that?
Okay. So, once you know that your baby has arrived, you know that your woman has gone through a lot during pregnancy, okay? During the first 6 weeks postpartum, she's expecting to sort of get some rest, to heal, for the hormones to sort of like settle a little bit. Um if it's you're able to sort of like give her some cooked meal, do that. If you can take the baby for some time so she can sleep, you can do that. If you can sort of like give her like a break, massage or clean the house for her, just do the help her as much as possible, because the pregnancy in itself is very stressful.
Mhm.
You dealing with hormones, like you become like a woman who has reached menopause. Like you're crazy, you are angry all over the place,
Mhm.
and you're tired, and nobody is there to help you. So being able to like recover and get through that stage becomes very difficult if there's no partner there. Once your partner comes in to give you support, like it's difficult, it's still difficult, but you don't get to that point of going into postpartum depression or postpartum psychosis. When you look around, you notice that the women that throw their babies around
Yeah,
away usually don't have any support.
I see.
Yes,
I see.
single mothers or mothers who have no support at home
Very true.
from their husband. So the support is very important. If you can't do it, you can bring your mother-in-law to help your woman to recover. That's if like it's a doable thing. Or in some parts of the world, you can check her into a postpartum hotel where they take care of her and help her to recover. And that's very helpful.
So, in less privileged places,
Hmm.
like in Zambia, I think I remember when my mom used to give when she was pregnant with the last brothers.
Hmm.
They well at that time we had grown, but there was always an elderly lady that
Who
would come
came?
who came through
Yes.
to kind of provide the
Yes.
support while his
Yes.
dad was hustling and juggling in with other things. For single mothers, yes, they don't have a partner present.
Hmm.
We're in the city now. So let's say you come from home and you are here and you are trying to juggle things around, the guy leaves.
Hmm.
How do you get past that?
It's very hard. It's really, really hard. Like you have to sort of switch your mind to a point where you have it in mind that it's just you and the baby and it's survival. Okay. And once your survival instincts are up, you're able to sort of tolerate that period a little better. But on the mind, it's not okay. It's very, very, very hard. You Lots of single mothers don't recover.
Man.
It's hard.
And when you don't recover, how do we get to see this? How can
I
we
mean,
get
you
them help afterwards? If
you
they
would
don't recover in 2 years, which
you
is the
would
time.
notice that the woman is different. The woman is different. She's not interested in anything. She's just concentrated on her baby and that's it. Like no relationships, mood is bad. Like she's just alive because she has to take care of somebody, but there's no drive, zero. Zero.
Does it if it's not controlled in 2 years, like you have
Hmm.
mentioned, does it ever change or the person has changed completely?
You can change completely. Pregnancy can make you a completely different person. Hmm.
I don't like you very much. I don't like you
Yeah,
very
but I
much.
say if the support is there, most women recover and recover beautifully. Yeah.
What was your experience?
My That's a good question. That's a good It was very hard for me. It was very hard for me. Like I told you, my baby came early and from I think 16 from 20 weeks I got sick. I was working in the hospital when I caught a bug. So I was sick till around 26 weeks. And at 26 weeks, I gave myself a shot of like a steroids because I'm like, hey, I need to prepare for anything. And 2 weeks after my baby was like had arrived,
Mhm.
it was a shock. I wasn't prepared for anything. So one day you're pregnant, the very next moment, baby is out. I went shopping. After shopping, I passed by the hospital to check because I wasn't too sure. Like I didn't like how baby was behaving,
Okay.
and I didn't go back home. Like that was the very day that I had my baby by cesarean section. Okay,
Okay.
so baby comes out and okay, where is the baby? You have no baby with you.
Yeah.
Baby is in ICU, and that's there's
That hits you.
yeah,
That
it hits
hits
you.
you
That
different.
maternal bond is not there. It's not there. It doesn't like after a cesarean section, you don't have that bond in the first place. You have to make lots of effort. Okay. Trauma bonds you.
Yeah.
So when you go through a vaginal delivery and you suffer to have that child, like that trauma, like, oh, finally I made
Mm.
it gives you that bond. But the cesarean
Right.
section is not like that. You're just there, they take the baby out. Maybe some people have a bond, but most people have a hard time bonding with their babies after the cesarean section. So you might hear that they are saying that when the baby is born, okay, just put the baby on her so that like there's a little bonding before baby is taken away or father bonds with the baby and stuff like that. But I didn't have bonding. Baby was gone, and I had to wait for that long to be with my baby. So it was a period where I felt very lost and ghosted. And you are home. You're supposed to be on maternity leave, but there's no baby there. And you're pumping because you have to sort of like pump for your baby.
Right.
Okay, you're pumping, you're not sleeping. Every 3 hours, you're pumping.
Right.
You are exhausted, hormones everywhere. I went back to work actually. I couldn't take it. I went back to work 3 weeks postpartum because I didn't see how staying home without a baby would be beneficial for me mentally. Because
Wait,
already
wait,
I
wait.
was
So,
I
so
was stressing my husband with my hormones all over the place and being nasty. So I just went
right.
back to work.
So they take the baby, then they keep the baby,
Yes, in the ICU.
then they discharge you.
Yes. But
Okay,
what will I be doing?
that is difficult. Yeah, because now it's like, yo,
I'm okay.
I need.
Yes. Yes.
Did you get to see your baby when you're at work?
Yes. Yes. So my department was right next to the baby's ward, right? So that was one of the reasons why I
It's
went
like,
back
oh,
to work.
I see you, baby.
So when I have like a break in between, I pump, I send it to the baby, see her, and like we cuddle a little bit if possible. Then I go back to work again. And when I'm done with the day, I go and cuddle and just say goodbye.
But then you have to say goodbye and
Yes.
go back home.
Yes.
Ah,
Yes. Every single day.
man.
Yeah.
For how long?
3 months.
You're joking.
Yeah. 3 months.
3 months. That's 90 days.
Yeah.
You are seeing her roughly 10, 15 minutes.
Yeah.
Damn. What do you wish we could make more known to the African community? Because they don't go to the gynecologist. We don't talk about the postpartum issues.
No.
And it's like you're supposed to be this strong, you're supposed to be this without problems. And I think that is beautiful that white women, even though we call them crybabies, that they're able to express some part of it because you're able to see clearly.
Oh, but the women cry in the delivery ward a lot at home. It's not that rosy.
Okay.
It's
Yeah, but when they come out, the picture is different.
Yeah.
So we don't know.
No.
And back home,
Nobody tells
the
you how it's going to be.
husbands don't go into
No.
the delivery place.
That's only because there are so many women in one place and one husband can't go and see the other, right?
I see.
Yes. In the private sector, you can go with your woman. You can be there when she's
Maybe I
delivered.
should brace myself and go in there. I just don't know if I'll be able to recover after seeing that.
You will. Maybe not. Maybe it
Yeah,
will
but
take you 2 years as well.
Yeah, but you see, this is what I'm
I'll
saying.
change your mind about 8 children.
But I don't want to change my optimism about 8 children. I don't want to not recover for 2 years because maybe she'll recover quickly and she wants to have sex and I haven't recovered. That means we are
But
suffering.
you have to compromise because most of the time the women don't recover, but the men want to have sex anyway.
Well, I will understand.
But how long will you understand? Because in maybe 2 years postpartum, she still doesn't want you.
I'm quite an understanding partner. But 2 years?
Yeah.
Oh, hell no. I can't do 1 week.
You see?
Oh, hell no.
So
no.
it has to be about compromise. You have to compromise somehow.
Damn.
Yeah.
Do I love sex too much?
No, you're a man. You have testosterone, and that's
so it's okay.
It comes with that.
Okay,
Yeah.
so I'm not crazy.
No,
then it's fine.
No, you're not.
All right. But man, so during the postpartum, I'm sorry if I'm getting too private.
No,
You
it's
stop
okay.
me as well. During the pregnancy, postpartum, how is the sex? Obviously, I think maybe it's less frequent. I can imagine from those differences. What was your case and how did you handle the conversation with your partner?
I was very sick. So that was the last thing on my list. I was very, very sick. Like I was throwing up all over the place. So instead of sex, we were cleaning vomits here and there. I mean, yeah, I was really, really sick.
How long did you get to recover? I think you look like you recovered in 6 months.
No, it took me a long while actually.
Really?
Yeah.
You did 2 years?
About 2 years, yeah.
That's how you know these 2 years.
I'm now beginning to feel like myself again.
I love that.
Yes.
That's beautiful.
It took me a very long time.
I want to recommend all my female friends here in the Czech Republic, Black specifically, to visit the gynecologist.
They should come to me.
Yes, thank you. Because most of the white women that I know do go to the gynecologist. It's a normal thing. Yes. But the black ones, they haven't gone there. They don't even know what it is that they should be going there for. I was like, no, just get registered. You go, they will double check. They'll tell you if everything is okay. If you have an infection, you get things fixed instead of having to deal with all these things. And then in the case of home, I think it should be a normal thing that ladies also go and see the gynecologist.
Yes.
Do you have any program that you teach women actually about it apart from the Facebook page? I saw more of the materials and the conversations.
Yeah.
Are you making videos?
I have been so busy. I started making YouTube
Yeah, you
videos.
were difficult for me to catch you as well. Yeah, I
But I
understand.
think I made only 5 or 6 videos. So I have it in mind to have like to make more videos. I have the plan drawn
Mhm.
for like a baby club where you come and listen to everything from the first day of your pregnancy till the very end, postpartum, um, menopause, everything.
Yes.
Everything is drawn, but I'm left with the time to actually sit down and teach about it.
Do you think men should somewhat get some
Yes.
pre-education
Yes.
about this?
Yes.
Do you offer that?
No. That was in the plan as well, but
Yeah, I want to
you,
contribute to that.
you know when you have to deal with men, sometimes the ego is a little all over the place, so it's
Ah,
difficult. So I just let it be.
I see.
Just
I
let
think
it
you
be.
mentioned it in one of the teachings that you have. So like, there's the ego part, even
Yes.
on the part of sex
Yeah.
itself.
Yeah.
Women getting satisfied.
Uh,
Guys, there's just this thing. It's like, okay, I know what I'm doing, and stuff is like,
But most people don't know what they're doing. No, they don't know what they're doing. They don't care. Once they reach their point, that's it.
Yeah,
But the women most usually want you to find out. Ask them, is this where you want me to touch? Is this how you want me
right,
to go? Is this the position that is okay for you? Like,
right,
because it's not same for every woman.
right.
There are some women that never orgasm during penetrative sex. And that's
Yes,
it.
yes.
Some would want like you to use a toy.
Mm-hmm,
Other people would want to use like be more physical with them
mm-hmm,
to reach
mm-hmm.
that point. But some men don't care. Most men don't care actually. It's in and that's it. They're done and that's it. We continue next time.
There's this thing,
Yeah.
my partner just like squeeze the boob and get in.
No, we don't want it that way. And plus, lots of men don't even know that when you squeeze the boob too hard, it's painful.
Right.
So they just squeeze and they're like, but the
And
woman is in pain and her mind is off what you're doing. She's now
so
in pain.
people don't know
And
how to have
tolerating
sex.
you. No. Back at home, like, because there's so much stigma, you always hide and do stuff.
Right.
You don't have somebody to actually tell you, okay, this is not okay. Do this instead, do that instead. And if you maybe turn this way, or if you like maybe raise the legs this way, if you use a lubricant, it's going to be better. People actually think that it's not normal or it's pathological for somebody to use a lubricant. Like,
Right.
it means that you're not okay.
Mm-hmm.
But it's actually okay
Mm-hmm.
to use a lubricant.
Yeah.
Not everyone is able to get like so wet like throughout the process.
Right.
If in the middle you're dry, just grab your lubricant, and not oil, not butter. Like, I mean, a lubricant.
Let's
Lubricant,
go.
like, a lubricant. Like, it's better to go for a water-based lubricant. Okay.
But doctor, I don't have lubricant. There's a bottle of olive oil here. So it's quickly let's proceed.
No. You will be okay,
Okay.
but your lady would have problems like
Okay.
later on, because
Yeah.
the oil will completely change the flora and the pH of the vagina, and she would have to deal with an infection later. She might not tell you, but she'll deal with it.
Oh man.
And I think it's unfair.
And the stigma that is there actually when we're talking about at home.
Yeah.
You're keeping a girl child and you're stopping them from going out. So people don't have information over that. It's like somewhat it's a taboo subject. And I think it should be more talked about so that people get to know how to perform safe sex,
Yes.
protected sex, and people will be much aware. Do you think people should not have sex before marriage? I think that I have
it's really not my business what they do. It's a choice, really. It's really a choice, yeah.
Do you
but
think it's cool though?
it's okay. It's if you don't want to have sex before marriage, when you get in and realize that things are not working, you keep quiet and stay there because it was your choice. Yes.
That's the
If
thing.
you try it and it works for you and you get married, fair enough. Because you might not have sex before marriage, and then later on you realize that you're not sexually compatible. And that's a very big problem.
It's the compatibility, it's actually
Yes.
real.
Yes. You're not sexually, like, no matter what you do, there's no sparks, no libido, nothing. So you don't feel anything. That's how come some women, like, they're married and they go for some bodybuilder somewhere, or some young boy somewhere where, like, she sees that person.
We call them
Yeah,
Ben 10.
yeah. And they just bring the sparks. He
Right.
treats her well because the connection is there, but there's no connection with the husband.
But so you have a partner.
Yeah.
How do you end up getting married but there's no libido? Is it because you act there's no sex before marriage and then
Yeah.
you find out later?
It's different when maybe you're just making out. Okay, you might have some sparks, but once you start the real thing, you might realize, hey, this is not it.
Okay.
I mean, this is not what I expect to feel. Or you're waiting to he's started 1 minute and a few seconds and that's it. You're waiting to get there. Women like need more preparation.
Definitely,
but
yeah.
he's gone, like he's done.
Yeah.
And you have blue balls. It's like, is that it? And he does that over and over again. There's no satisfaction.
Can sex improve?
Yeah, you have to work on it. You have to work on it.
Guys are having premature ejaculation.
Yeah. If you're obese, drinking lots of alcohol, have diabetes, doing lots of porn and masturbation, of course, it affects your sexual life. Okay. If you stay away from those things, you're very likely to like have an improved sexual life.
I had the recent podcast. The guy said porn is not regular sex life. So you can have a healthy sex life. Just make sure you and your partner get to understand each other and get to create a healthy kind of...
But you know how guys are, like, when it comes to porn, like every second he's hiding somewhere and he's doing his own thing, then well, that becomes a problem. The expectation, he's seen some good moves on the video and he wants to try it with his 120-kilo woman who is not able to. Then it becomes a problem.
She can't split like that.
Yeah.
I see. Oh man, that's true. That's true.
It changes your expectations.
But here's the thing. I had a girlfriend before.
Okay.
Then I have now my current girlfriend. I have found that Black women act like they don't want to have sex.
But that's not true. It's just because of the
culture. This is my experience. Okay, yeah, like you're saying. Yeah. So that is not true. It's a culture. It's a culture they act like they don't want this. They don't want to engage. And they don't want... It's like, no, it's always guys. I was like, no, it's not always guys. I think women are very horny as well. And they want to engage in the sexual activities. So that means guys... Well, we're not horny at the same time, right?
Yeah.
So we need to communicate these things. But if women are not engaging, at least in the case of Zambia, at least guys tell me these things.
But that back home, a woman who wants sex is sort of like a taboo. So even though she wants it, she'll keep quiet, go and take a shower, or maybe listen to some Benny Hinn or, some church music, so that somehow the libido just goes away.
The thing is, take a shower.
Yeah, a cold shower.
Why? I want to have sex.
No, but
why am I showering?
They're made to feel that like a woman who is not married and having sex is sort of like the dirt in the community. So if you're raised that way, even when you get into that marital position, you still have that in mind that it's not okay. You begin to see sex as a bad thing. Despite the fact that you want it, anytime you are supposed to do it, your mind just goes back to the fact that you might think that you're how do I put it? It's a sin, like you're doing something that is bad.
Right.
Yeah. So you stay away. You want it, but you stay away. So that you're normal.
Is this where female circumcision came in?
No, the women don't want female circumcision because it's done under very unhygienic conditions and it's painful. Okay, but female circumcision was put in place so that they are kept, or the women do not have sex before marriage.
Okay,
and sort of like to dampen their libido. Okay.
But if they dampen their libido, that means the libido doesn't come back at all because the clitoris... Well, they cut the clitoris.
It depends on the type. There are different types of different stages of
Ah,
mutilation. So they can just take your labia, or they can take part of the clitoris,
that's
or they
not
can just
nice.
take everything and just sew it shut and leave just one hole there.
That's tough.
Hmm.
But most of our women, well, not most of them, but maybe a couple number of them have gone through that,
Not a lot. A few people have.
mostly on the western side of
Yeah,
the continent.
yeah.
That was where the culture was more
Yeah.
dominant. I don't think that is the case in Zambia particularly, but I think people should talk more about it and engage more about it. I want to contribute to whatever you're working on. And when I saw it, I spoke with Dr. Semata.
Yeah.
Yeah, Ian. He told me about you. I was like, I want to contribute to this. And I was particularly looking for a gynecologist who has had a child before so that I can have all this conversation
Yeah.
and pick all that stuff. So I hope we can get people to be more involved in your program.
Hopefully.
And
Hopefully.
yeah. So just so that they can find you, where do you work and how can they register if you're taking new clients?
I work in Canadian Medical, but that's for like only registered clients. Okay. I also work in Baba Care, which is in Prague 9, and you can find me on Instagram. If you look for my name, or you look for Gyne Consult, I have my own like a consultancy. You can just write to me. For example, if you need just an online consultation, you can book with me. I'll explain your results to you, give you a phone call, and if there is a need for me to see you in house, I can also direct you to Prague 9. That's also
Sounds good.
okay. Yeah.
Doctor, thank you so much
You're
for
welcome.
coming through. Ladies and gentlemen, it's been really an informative conversation. Remember to educate yourself. Guys, please, let's learn about women's health so that we can tell our partners and be able to protect them from some of the, severity of these issues that get to come around. But, oops, I'm going to have all the links everywhere where you can find the doctor and you can register for yourself. And for those who are not able to see her in person, you'll be able to read and even interact through her very channels of communication that she has. With that, enjoy your time. Cheers.